Hi everyone, I'm Sandeep Sahay. I'm a pulmonologist at the Houston Methodist Lung Center at Houston Methodist Hospital. And my primary interest is pulmonary hypertension. We see all types of pulmonary hypertension with special focus on group 1, 3, and 4 pulmonary hypertension. Today, we're going to talk about chronic thromboembolic pulmonary hypertension, commonly referred to as CTEPH, and you may hear your doctors saying this term. What it basically means is that in certain patients, after having an episode of pulmonary embolism, that is clots in the lungs, or sometimes after having the clots in the lungs, that those clots travel to the lung and they end up there in the lungs. Despite of treating them with blood thinners, these clots do not resolve, and as a result, they end up developing pulmonary hypertension because it causes back pressure changes because blood is not able to flow through those pulmonary arteries because of the clot sitting there. And then it leads to higher pressure in the pulmonary artery, leading to the dilatation or enlargement of the size of your right ventricle, which is the right lower chamber of the heart. To diagnose CTEPH, we need expertise. We suggest that you seek attention at your nearest pulmonary hypertension comprehensive care center. If you are in a far area, probably reach out to a regional care center. These kind of diagnoses need spatial attention and spatial evaluation. To diagnose CTEPH, you simply need a right heart catheterization, but at the same time, a specialized technique using a different catheter called pulmonary angiogram can also be performed. And with these two testing, you could confirm the diagnosis of chronic thromboembolic pulmonary hypertension. After an episode of pulmonary embolism, you would notice that in 3 to 6 months, you would continue to feel shortness of breath, and your shortness of breath is not resolving. If the disease is fairly advanced, you may also notice leg swelling. Sometimes you may feel chest pain also. You will feel exertional shortness of breath that you're not able to do your day to day activity. In severe cases, you may notice that your oxygen level is also dropping and you may need supplemental oxygen. But these are the common general symptoms with which patients present. CTEPH is a condition which generally starts in majority of patients after an episode of pulmonary embolism. Patients develop lung clots for a variety of factors. They may have had a long flight. They may have some genetic conditions which predisposes them to develop clots. Commonly, we talk about antiphospholipid syndrome. This is one of the conditions which leads people to develop clots in the lung. And subsequently, these patients are at somewhat higher risk to develop chronic thromboembolic pulmonary hypertension as well. But prolonged immobilization, staying in bed after the surgery, these are the factors which can commonly lead to have either a lung clot or a clot in the lungs, which subsequently, if doesn't resolve completely at period of around 6 months, you tend to think that you may have developed CTEPH if you are having symptoms. To manage CTEPH, it's, as we know, as other forms of pulmonary hypertension, it's a rare condition and it needs spatial expertise. So patients who think they are suspected to have CTEPH must seek attention at an expert care centers. And generally, these expert care centers have multidisciplinary team managing these patients. And these teams generally includes pulmonologists like myself, cardiologist, intervention cardiologist, and a thoracic surgeon also. It is important that we correctly identify CTEPH because this is one of the form of pulmonary hypertension which is curative in nature. In roughly 60-70% of patients, if a right kind of patient seeks care at the right center and gets the surgery done, you may see a wonderful outcome. Now, when we talk about the management of CTEPH, you have to get multidisciplinary evaluation after performing all these specialized testing, that where is the clot and how high your pressures are. These are the two important factors to determine whether you would need a surgical intervention or whether you would need some modified newer interventions called balloon pulmonary angioplasty. In certain patients, medical management is also considered, but again, discuss this with your expert care center physicians. Now, when I refer to surgical intervention, what commonly a surgery done is called pulmonary thromboembolic. It's a highly specialized surgery which is done only at handful of expert care centers. So you need to identify those centers close to your place and seek attention over there. If you are the right kind of patient with the right kind of clot situation or the location of your clot in the chest, your surgeons can perform these surgeries and you may be cured with this disease. However, in roughly 20 to 30% of patients, sometimes surgeons are not able to get all these chronic clots out. You may have some degree of or milder degree of pulmonary hypertension after the surgery. And if that is the case, you may consider an opinion from your expert care center doctors about consideration for balloon pulmonary angioplasty. Balloon pulmonary angioplasty is a relatively new technique in which a doctor inserts the catheter to your pulmonary artery, which has a balloon at the tip of it, and they find the location where those clots are, and then they dilate those smaller vessels. These are generally smaller vessels which your surgeons cannot reach to take the clots out, and that way they open up those vessels. This can help to reduce the pressure, it can improve your exercise capacity and your symptom burden. So we suggest that you seek opinion from the expert care centers. In certain percentage of patients, after the surgery and after the balloon pulmonary angioplasty, there may be a possibility that they may need to continue some medical management. Currently in the United States, there is only one medication which is US FDA approved. It's called Riociguat. So please discuss with your physician if you are a candidate for this medical therapy. There may be an option for you to take this pill. So the pulmonary thromboembolic surgery is an open heart surgery. Your surgeon has to open your sternum and go inside your pulmonary artery. After the surgery is completed, you expect 6 to 12 weeks of recovery time. If everything goes well and you heal well, you would be able to resume your normal activity in approximately 6 to 12 weeks time. The surgery is highly specialized. We suggest that you reach out to the expert pulmonary hypertension care centers to discuss about the surgery if this is the right treatment for you. This requires a multidisciplinary team, as I discussed earlier, and an expert surgeon who is experienced in performing these kind of surgeries. Chronic thromboembolic pulmonary hypertension is a rare form of pulmonary hypertension. We suggest that you seek attention about this disease even at your first clinical suspicion. As a patient, I would like you to go to Pulmonary Hypertension Association to read about the disease and educate yourself so that you are familiar with all the treatment options. I know a new diagnosis, and specifically when you hear about pulmonary hypertension, it does cause significant anxiety. But the best way to deal with anxiety is to educate yourself. And I think Pulmonary Hypertension Association has a fund of resources which will be very helpful for you to seek attention from those resources. They have local patient support group where you may meet and discuss your concerns with patients like yourself. They have educational resources on their websites. They have videos like this one where you can educate and seek further attention about your disease. As a pulmonary hypertension physician, I treat my patients who are struggling with this disease with extreme compassion and empathy. I think that should be a trait for all the physicians who take care of patients with this disease. As a healthcare professional treating patients with pulmonary hypertension, it is important that we focus on not only just the medications, prescriptions, but also our patients' social life in general, their burden of the disease on their day-to-day life, and also the burden on their healthcare professional.